Hello, everyone. Today we're going to talk about the mental health during COVID-19. This was a group project given to us by Professor Pocholo Velasquez in our summer term in Alexandra College. And our group members are Manveer Kaur, Gandharv Agarwal, Harmanjot Singh, Siddharpreet Kaur, and Arshpreet Singh. So let's first discuss about what was COVID-19. COVID-19 or coronavirus was an outbreak we all experienced in 2019. It was a virus spread through face-to-face contact between the infected person and a normal person. It usually takes about 10 to 12 days to see visible symptoms on the normal person. Sometimes the person might look normal, but he or she might was infected with the COVID-19 virus. The most common symptom was fever, cough, tastelessness, throat pain, body aches, back aches, and sneezing. Heartache was a symptom but was less common. Moving on, the mental health we all faced during this was severe, and the first disorder we all could face was stress and trauma. Acute stress disorder. Due to this disorder, people was not moving outside like for 1 month. Didn't eating anything outside after the lockdown. People just hearing the news about the condition which make them more stressed. Post-traumatic stress disorder. The death of a family member or a friend or a relative could make them more stressed. Because of nothing to do, people might remind of their old memories, such as tragic events of their life, which indeed create more stress and make them more anxious. The news of number of people who died because of this virus make them more stressed, and eventually it create more traumatic stress. Dissociative disorder. During COVID-19, people took excessive stress of their businesses and finances. People used more social media during the pandemic, and some were thinking and relating their life with the movies, traumatic events, which produce more stress. Fear to go outside during the COVID-19 was also a stressful event. Moving further, COVID-19 experience, anorexia nervosa will explain by another group member of ours.
So myself, Sadak, and in this COVID-19, I faced many problems, and I would like to tell you about the anorexia and nervosa of my. This is my problem in the COVID-19. So COVID shut down all the businesses, schools, colleges, even the gyms, pools, recreational places. At that time, I usually spent most of the time with my phone and the internet. Celebrities also spend most of the time posting pictures about health and the diet. I considering myself fat even if I was healthy and fit. Whole day I didn't eat anything, counting each single calorie, started seeing my body in a negative way. Furthermore, I started eating just only some cereals in the morning every day and nothing else. Later on, I came to know that I followed restricted type of anorexia after therapy sessions. I told my symptoms to the therapist like missing menstrual cycle, low blood pressure, hair fall, and yellow nails. I also have sleep disturbances, electrolyte imbalances too. Just because of the COVID-19, which is a stressful event like a depression, that makes me have to eating a disorder like anorexia. Like me, many others also face this problem. My therapist helped me with the negative cognitive behavioral therapy to overcome anorexia. CBT helps me to change unhealthy thoughts and the behaviors. My main goal is to help to learn and cope with the strong emotions and build healthy self-esteem. This treatment for anorexia was very effective. Like I started gaining healthy thoughts and change disordered thoughts, which leads to eating disorder. With time, I regained my weight and recovered from malnutrition and started eating normally. So, the next COVID experience will tell by another my class or group member.
So during COVID-19, I suffered with anxiety. In the second month of the COVID-19 pandemic, I developed feeling of fear and being in extreme danger. I felt extremely worried and afraid. The news reporters said the virus was spreading fast and killing the majority of infected people from Western countries, and vaccination was not an option. So I started to think that I was going to die at a young age and feared a family member would die sooner. And recurrent thoughts of what the COVID-19 would do to me contributed greatly to my anxiety disorder. I was afraid of contracting the virus and lacking an understanding of what to do. I asked my parents to stay at home. When they left to get food, I feared greatly for them, and then I started fidgeting. To overcome the anxiety, cognitive behavior therapy helped me cope with this fear. I also started exercising. I picked up a new hobby and a healthier lifestyle. I embraced staying home with my family, and WHO started giving relevant directions on COVID-19 control and eradication, making me feel safer. So, the next topic will be discussed by my other uh, classmate.
Hello everyone, my name is Manveer. So today I'm talking about the experience of depression during the COVID. So I still remembers when pandemic hit all of us. I was in my flight to Canada with the layover in China, and my flight got cancelled and there was no other flight for next 2 weeks. And being present in the center of virus outbreak with all the choices was a depressing moment for me. Seeing all those infected people and not being able to go anywhere safe, just laying on airport for next 2 weeks. But then eventually, after some time, somehow I managed to arrive Canada in a hope that everything will all right. However, it was just a delusion of mine. Everything went online, no outgoing, no friends, no family, no social life, with ending up creating a depression phase for me. I started feeling lonely, low in self-worth, but thanks to my family and Zoom, which helped me to get over through that phase. So the next experience was discussed by my other group member.
Hello, everyone. Germophobia and COVID-19. Immediately after COVID-19 was declared life-threatening, social distancing was mandatory. The conditions for curbing the spread of the virus were washing hands and keeping cleanliness. There was a possibility of getting germophobia without obsessive compulsive disorder, which accelerated my disorder to germophobia because I had an obsession with the order and exactness. Operant controlling led to the onset and accelerating of germophobia. Moving further, social media and agoraphobia is another topic. Social media provided information that was scary, leading to fear of that and infection. The false information and true information were hard to distinguish. Protective measures was taken into place in our homes to stay at home, and anxiety originating from the fear of infection led to accelerate body sensations. I feared going out because nothing made sense on how to cope up with the pandemic. Moving further, it was hard to go outside the house as compared out COVID-19 was a widespread. After recognizing the problem, I started seeing a psychologist who recommended behavioral therapy. A psychiatrist prescribed serotonin and antidepressants. The integrating medications and behavioral therapy helped me cope up and with outgoing and accepting the dangers of the virus while trying to protect myself. Thank you everyone for listening to our project. Hope you have a good one.